Hello, my name is Dr. Rebecca Lytle. I've been working as a mental health professional for the past 10 years. Currently, I work at Gray Sloan Memorial Hospital. Mania is an emotional disorder that causes people to have abnormally high psychomotor activity. Some specific symptoms of mania are excitement, rapid movement of ideas, unstable attention, sleeplessness, and confusion between reality and imagination. People with bipolar disease go through times with low energy and mental depression, and also times of high energy and mental confusion. Over the past year at Gray Sloan Memorial Hospital, out of 2,500 mental health patients, 157 have had mania. Of the 157 mania patients, 2 have had the specific form of megalomania, and 42 have had pyromania. It is common and oftentimes necessary to admit mania patients into the hospital for a couple of days. This is important to properly diagnose the patient and determine the correct treatment. For most cases of mania, medication is the best treatment. I typically prescribe either antipsychotics or mood stabilizers. Sometimes a combination of psychotherapy with medication is extremely effective. For acute manic episodes, I would most likely prescribe antipsychotic medication because it works faster. However, for long-term treatment, mood stabilizers are the best treatment option. Patients may need to be on mood stabilizers for the rest of their life. A 25-year-old Caucasian middle-class male patient was admitted to the hospital last year. A friend brought him in because he was concerned that the patient would hurt himself by jumping off of the roof of his house. The patient was admitted to the hospital and stayed for 2 nights. Other than previous manic episodes, the patient had no other concerning medical history. He had previously been given antipsychotics after a manic episode, but the patient hadn't taken this medication in over a year. Since the episodes have continued and appear to be a serious threat to his health, I prescribed lithium, a mood stabilizer. He will most likely stay on this medication for the rest of his life. I also recommended that he visit a psychologist for psychotherapy. It's important that health professionals understand how to properly diagnose a patient. This is difficult, especially with pediatric patients. Unfortunately, it is oftentimes missed, and it oftentimes takes years for someone to be properly diagnosed, which, as we know, lessens the likelihood of the patient recovering. Thus, we must make sure that we fully understand how to properly diagnose a patient with these illnesses. Also, it is essential to understand that not every patient with mania will meet the exact definition. This is especially true for children. The reason behind this is because children's brains are still developing. Therefore, it's important to not only understand the textbook definition of mania, but to also be able to spot it in children who may not meet the exact definition. Lastly, the biggest problem that needs to be solved is prescribing patients the correct treatment. Obviously, the first step to this is getting the correct diagnosis. Most mania patients are treated with antidepressants for years before a doctor realizes that they need to be on mood stabilizers. This is a serious problem because the mania patient is continually getting worse over the period of time that they are being treated with the wrong medication. In addition, during manic episodes, the patient is a harm to themselves and possibly other people. Lastly, without being properly diagnosed and properly treated, people with mania aren't living their life to the fullest potential. Thank you.